Hi, and welcome to Wine Wednesday with Kriz Physical Therapy. I'm Dr. Tiffany,
And I'm Dr. Mike.
and on this episode of Wine Wednesday, we are going to be talking a little bit about how we treat our clients after having had a knee replacement. So, status post surgery, and what are some of the things that we look at. But before we do that, I forgot.
Cheers.
All right. Since I'm laughing, go ahead, take it away, Mike.
Okay. Well, when somebody comes into us, most often they've had home health where they've done the basics, they're able to walk, they've started doing an exercise program. And then when we see them, we dive into the potential causes for the issue. I mean, certainly we work on the range of motion, which includes soft tissue work, maybe scar mobilization, but we also have to look at how the kneecap interacts with the femur and how the tibia and the femur interact, whether there are joint restrictions that might influence how that knee is going to bend or straighten. And then where the fibula meets the tibia at the top and at the bottom, those can also influence how the tibia moves or the femur moves. So we look at those as well. The hip is farther up. You've got to look and see how that moves. And then, of course, how the foot moves. So we look at that entire structure and see if there are limitations there. Once we've assessed and treated those, we're progressing the exercises so that people can be more functional, getting in and out of chairs, up and down steps, curbs. They have good balance and can perform their activities of daily living without feeling like they're going to fall on their face.
Right. So we're looking at also core stability at the pelvis, and not just thinking about the strengthening of the legs as everybody generally thinks after a knee replacement, but you have to put all of that into account so to make a comprehensive program so that you can get back to doing what you want to do.
Right.
All right. And cheers. Thanks for watching.
Cheers.